Okay, so this is what we're going to do. We're going to test 3 different muscles here. If you can imagine your client, for whatever reason, could have a shoulder problem, for whatever reason, we don't know. We might need to establish what's actually tight. Now obviously Pectoralis Minor plays a big factor in tightness, but also so does Corocobrachialis, so does your short head of your bicep, because they're all coming to that coracoid process. Okay, so the first thing we're going to look at is the height of the actual shoulder joint to the table on both sides. And looking at it, it is marginally higher on this side. So it could be, I mean, I can palpate pec minor, and I can feel there's a little bit there, a little bit of tightness there, but it'll probably be the same on the other side as well. But it's establishing which one's tight. So if I lift the arm up there, I've just allowed Biceps Branchii short head to relax. And what I should do is go into that position, get me to the joint. Yeah, so you've got your clavicle coming through, kind of onto the joint there. Now if I do that to get that measure, and I do that, I've allowed me short head of my bicep to relax. If there's no distance in movement, it's not going to be massive, but if there's no difference in movement, I know it's not that. If I take the elbow now and lift the elbow up a little bit, I'm just getting rid of Corocobrachialis as well. If there's no movement again, then that stipulates that it's a tight pectoralis minor. And that's how you can isolate which one it is.
Right.
Yeah?
Yeah, sound.
So your first one is obviously upper trapezius. So your client sat in a neutral position, nice and square. What you're looking to do is extend, keeping the head neutral, head to the side. Should get 45 degrees, thereabouts. Likewise, both sides. I'm a bit more restricted on that side. Yeah. So there may be an issue, but this is the one I've got a bit of a shoulder issue with. And then other one is checking Lavator Scapula range of motion. So what I should be able to do is turn my head 45 degrees, and I should be able to roughly get to my chest, chin to chest, and then back. A little bit tighter on that side, but yeah. So they're what you're looking for when you look at range of motion of them. So this is a Latissimus Dorsi elevation test for range of motion or tightness, and we'll also tie in the pec major to it at the same time. So all we're going to do, bring the arms back. I just want you to let them totally relax for me. All I'm going to do, just nice and lightly, just going to do that, and then I'm just going to let them flop. Okay, so what we can see now is a tightness on the left side, because ideally we are looking for straight up 180 degrees, but that's marginal, so I wouldn't be too worried about that. Elbow nicely to the table, which means his pecs not too tight at all. We look to this side now, we can see clearly now there's an angle there. It's not massive, but there is an area of tightness to his Latissimus dorsi on his left side, and the fact that his big gap, the elbow's off, says he's tight across his pec as well, because it should be down there, and it's wanting to come back up. So that's tying the two in together. Okay?
Yep.